This one. Okay, this one we're going to start with a new video because we run out of space on the other recording device. This one is new, and it shows we are recording.
Right.
It's counting. So, and I believe the last thing we did on the other Nokia recording device was we measured your blood pressure.
Correct.
On the right hand, on the left,
one.
and it was 110 on the right and 110 on the left.
Correct.
Okay, so now with I didn't clean this lens of this one. I hope it's gonna be clean. Okay, so we did the radial pulse. The radial pulse was 70.
Right.
It was 70 beats, and it was rhythmic and normal.
Right.
Okay, so your blood pressure is, and then of course you deny pain. You don't have any pain anywhere.
No pain.
Okay, good. So, and then the temperature. The temperature is 97.1.
Right.
Yes. And so now we can go to this other where you are still sitting, and I'm standing in front of you, and we're checking your hands and your nails and everything.
And
so I'm going to be, yes.
For 1 minute.
Yes. Okay. Can you hold this for me? So that, okay, just like this, so that you can catch me. Yes. So 70. That's 70. That's perfect. Okay. Can you? No. Yeah. So just hold it like that. 1 second. So we check the pulse, and the temperature is okay. And then of course we check your skin pigmentation. And then the next thing we need to do is we need to check your hands, your nails, to see how they are. We're checking for clubbing, for deformities, your nail bed, and capillary refill. So now we're going to put the lights so that we can see properly. Okay, now we're checking your nails. We can see that there is no clubbing of the nails, no clubbing. Bilaterally, no clubbing, and there are no deformities. Your nail beds, they are white pink. Okay, and then we're also checking for capillary refill. We press and we check. Okay, we're less than 3 seconds. Okay, so that's okay. Of course, your skin is moist. The texture is smooth and firm. Usually, this is how we check for tenting.
Right.
Tenting shows you're dehydrated.
Yeah.
We leave it and we see if it sticks. If it comes back, that's it. Okay. So your sugar is normal, no tenting, no lesions. You saw no lesions. Now we're going to be checking while you're still sitting down. We're going to be checking for your head and your face.
Okay.
We're going to be checking for your hair, your scalp, to see the height. So we just check for the head. Okay, we check for the hair, we check for the scalp, and then You have a slight male pattern loss of hair.
Yes.
Your head is normal cephalic.
Yes.
Yes, no lesions. You know, and then we can see that your face is symmetrical. Yes, it's symmetrical. No weaknesses. Can you frown? Just frown for me. Lift your eyebrows. Okay. You see, the symmetry. I can see symmetry. Okay. Now, another thing they want us to do is to check the pulsations of your temporal artery and to check the movement of your temporomandibular joint. And this is how we do it, because this is the position of the temporal artery right here. We're going to be palpating it, and we can feel the pulsations of the temporal artery. Yes. Now open your mouth. Just open and close. Okay. Open and close. No crepitance, no sound. Do you feel any pain?
No.
So what we just did, we checked the movement of the temporomandibular joint, and then your temporal artery, which we could feel right here. It's good. The pulsations are like +2. We define it as +2. It's normal. It's not pounding or abnormally weak. Okay. Now the next thing they want us. Okay, your visual fields. Now, there's something they call the confrontation test. We're going to use some opaque materials. Now, you can use this and just cover your right eye, or the left, or anyone, and then I'm going to use this to cover mine. Okay. So what I'm going to do is, I'm going to be coming from this side. Okay. So when you see my finger, you say noun. Okay. Just.
But I'm covering. Okay.
Okay. Cover this other eye.
Yeah, now I can see it. It's easier to see your finger.
Now look straight. Okay. Don't look to me. But when you notice my finger coming, say now.
I see it now.
Okay.
Now.
Okay.
Now.
Okay. So that's what they call the confrontation test.
Okay.
You know, it is normal with you. Okay. So now we've done that one, and your visual field. Now there's something they call checking the extraocular muscles. You know. So this is how we do it. Keep your head steady. Don't move it. I'm going to check your field of vision. When just follow this object, okay, with your eyes, only with your eyes. Don't move your head, just follow it with your eyes. Okay, what we just did, we checked the 6 positions of gaze. It's called the extraocular eye muscles, checking their, how they are functioning. And in that way, we're checking the cranial nerves, the 3rd, the 4th, and the 6th. And with you, it's normal. Now, we're going to have to check your conjunctiva, your sclera, your corneas, and the rest of them. Okay. They say this shouldn't take more than 30 minutes, but from the look of things, it's probably going to take a little bit more than 30 minutes. Now, you want us to check your sclera. If you could can you remove your glasses?
Yeah, sure.
Yeah, you're going to put it right back. I'm just going to be checking your sclera, okay, and your conjunctiva. And then your corneas, your iris. Then they also want us to check the pupils. Now, just shine this light. Okay. Okay. Then I'm going to approach from the side. Okay. Okay. So that is good, because what we were able to find out is that your conjunctiva is clear. You know, it's a little bit because of racial background, you know, a little bit. Yes, sclera is white. Your corneas are smooth. They are non-cloudy. Your irises are round, regular. Your pupils are round, regular, equal in size bilaterally. And okay. So now we're gonna look. Another thing they want us to look at is the ears. You know, they want us to check. So we're gonna look at the ears, examine the anatomy of the ear, the tragus. Okay, we're gonna compare bilaterally one ear to the other, and they are equal in size. And then, okay, bilaterally there's no swelling. You don't. Then usually we press at the tragus, you know, because if there's like a otitis media, usually when you press at the tragus, you will feel some tenderness. You don't feel any tenderness, right?
No.
Okay, good. Okay, so that's good. No tenderness. Your tympanic membrane is translucent. Your hearing is normal. The Rhine test and the Weber test are all within normal limits. Good. So now now we'll go to the nose. And what they want us to do in the nose is to test for patency. Patency is like I could close one and you take a deep breath. Take a deep breath and breathe out, and I can see that it's through. And then you take a deep breath in and out, it's through. So the nose is patent. Good. Okay, so and we've checked the nasal mucosa is red, smooth, moist, turbiness and red color. Now they want us to check the mouth and the throat. Now for this we need looking for. We need this. Okay. We're checking the lips, the buccal mucosa, the teeth and the gums. Do you mind? Okay, yes. So we need to check. You can stick out your tongue. Let's take a look at the tongue. Okay, you can. I don't tell what that. Raise your tongue up. Okay, good. Now we can see the teeth, and we can examine the nasal, the buccal mucosa. We can see, yes, and then we can also, we can also see the anatomy. We can see that the lips, they are not cracked. We can see the teeth are white and evenly spaced. The upper and lower jaws are properly aligned. Bite down for me. Yes. I can see your upper and lower jaws there aligned in good condition. Your gums are pink. Yes, and the margins are tight, well defined. Okay. Your tonsils are +1. Your uvula is in the. Stick out your tongue and just hold it. Okay. Your tongue is in the midline. That's good. Okay. So now we'll go to your neck while you're still sitting down. We don't, first of all, we inspect. We don't see any pulsations. We inspect, no pulsations. Good. Your head position is midline. Yes. Your accessory muscles, they are symmetric. Okay, that's good. Okay. We already checked the range of muscle when we started, so we don't need to the range of motion of we check your neck.
Right.
We checked it already. But just do me a favor. Touch your chest with your chin. If you can do that. No, just touch your chest with your chin. Yes. See, that's a full range of motion. And you didn't feel any pain. Okay. Good. Okay. Now do me another favor. Touch with your chin, your left shoulder and your right shoulder. Yes. Okay. Good. Good. That's good. Okay. Okay. Now for this one, they want us to okay, we check your neck is symmetrical in the midline position. Your trachea is in the midline. The range of motion, and the muscle strength is normal. Now we're supposed to try to palpate your thyroid gland, even though normally if you don't have thyrotoxicosis, if it's not inflamed, it's hard, but we'll try to approach it from the palpation from the back. Okay, so if you can hold this way, let me just see if I can get this. So I'll try to palpate it. We just need to reach your neck. Okay, so we'll just try to palpate it from the back. While I'm moving away from this, I'm going to try to palpate. Okay. Good. So just like in the textbook, in the normal person is not palpable unless there's a pathology. So we couldn't palpate it. Okay. So now you have to check your chest and your lungs. We check the thoracic cage. Yes. Thank you very much. Yes. I hope the light is not in your face. Now we can see it's symmetric. Your thoracic cage, but it's symmetric. And we checked. If you could stand up, I want to check your spinous process. Okay, because usually it's straight. It's straight. You can sit back down. You can sit back down. Straight. Straight. Your thorax is symmetric. Your ribs are sloping. You can see from palpation. The ribs they are sloping down. Okay. While breathing, your chest bilaterally, this symmetric expansion. Because when I put my, can you hold? Yes. Because what we check is we palpate. Palpation is we feel with our hands. When you breathe in, you see that the left part of your chest and the right part of your chest, they are actively involved in respiration. You understand? They rise and fall uniformly. That's what we mean by symmetric. Okay, so we've done that. Now, patellar femorus. What we're going to do with patellar femorus, now I need both of my hands. Can you hold this? Just pointing at the chest. I'm going to ask you to say 99.
99.
Say 99.
99.
Say 99.
99.
So equally we're checking, it's equal bilaterally. So, okay, on palpation. We didn't see any lumps or tenderness. Your spinal process is straight. Okay. Now there's something they call the CVA tenderness. Now, if you could stand up a little bit for me. Now, I'm going to do a little palpation here. I'm going to put my hand here. I'm trying to see how I can fix this so that you can actually. I'm going to sit put my hand here and check if you feel any no pain, right? Well, we only have 10 minutes left on this. We have to hurry up because this one is only 30 minutes.
Hurry up, please.
Yeah, we have to hurry up,
Please.
Okay, so we checked. Okay, your respiration is intact. We now do the palpation because the lung fails for resonance over the lungs. Okay, so if you sit down, I'll just because now hold this for me. Yes. Over the lung fails. We'll start from the apex. Yes, from the apex. Okay. Then what? So in percussion, we observe you have resonance, which is good. Okay, so breath sounds. Now I have to listen to the breath sounds. Bearing in mind that we have just 9 minutes left on this one.
Yes.
You have to just hold this and I'll listen. Just do as much as you can.
Yes.
When the video is Just breathe in. Out. In. Out. In. Out. In. Out. In. Out. Okay, so I'm gonna listen to the back. Breathe in. Out. In. Out. In. Out. In, out, in, out, in, out, in, out, in, out. Okay, good. So that's perfect. So we observed resonance. Okay, so that's beautiful. Now let's check. Now usually the palpation for breast, we're checking for abnormality because the breasts are supposed to be symmetrical, mobile, no dimpling, and no nipple discharge. So I'm just going to be checking, no masses. I'm not seeing on the left and the right, and then it's supposed to check if I can see there's no discharge already. Okay, so now we're supposed to palpate also the axilla, because God forbid if there's any infection, the lymph nodes, they could be increased. So if you raise your hand a little bit, I'm just going to palpate. I don't feel there are no increased lymph nodes. You understand? The lymph nodes are in order. Okay, thank you. You can put it down. So the jugular vein, your enorm, your heart, your pericardium. Now the apical pulse, we usually sense it at the apex. When we put our hands over the apex of the heart. There's no pericardium thrills, no apical. Your heart sounds. Now we listen to the heart sounds. Quickly run out of time. So okay, they're all within norm. Okay, they are sitting up. Your stereognosis in this, you close your eyes. I'm going to put something in your hand, and you're going to tell me what it is. Yeah. Keys. Okay. Okay. So we got that one. Now. We've already done the one that you walk across the room. Yes. Another one that we need to do is the one that you walk heel to heel.
Okay.
You know how to do that one?
Yes.
That's the one that you walk like this. Heel to heel. If you can do it for me, yes. That's perfect. Because what that's checking is the cerebellar function, is checking your balance. That's good. You can come back. You see. Wow, we have just 3 minutes left on this recording device. Let's see what we can do. Squeeze in. Okay. So we've done the male genitalia outside the camera. Everything is normal. Let's see. Your sensation, they're all correct. No abnormalities. Now we can check your dorsalis pedis, popliteal. I could check the popliteal pulse, and okay. Dorsalis pedis is and in checking your abdomen is flat, symmetric. There's no apparent masses. Now this one is supposed to be supine. That is lying down, but we don't have much battery power to do this. But I can see that your abdomen is symmetrical, flat, no masses, and your bowel sounds what do we do? I guess that's Babin's T reflex is negative, rhombic sign is no rhombic sign. That's it. I guess that's it. Okay, thank you very much. Okay.